we've got some guidelines as far as moles or new spots that can help us identify these early. We call them the ABCDE, like just the rules of the alphabet. And these are specific to melanoma. A is asymmetric, right? So anytime that you have a nice mole, it should be relatively round. It doesn't have to be perfectly symmetric, but it should be symmetric in what we call at least one plane. So like you can see that if you folded this over here, it wouldn't match, right? And if you folded this over this way, it also wouldn't match, right? But you could see how some moles, you could actually fold them over one way and it would still look pretty darn good, right? And let me draw an example of that. We call it symmetry in one plane versus symmetry in two planes. So if we have a perfectly round mole here, then if you folded it over any way, it would be symmetric, it would match. Does that make sense? But you can see have something that's symmetric in only one plane, right? So like this is not symmetric in this plane. Like if you folded it this way, it would not be symmetric. But if you folded it this way, it would be. And so the more symmetric it is, usually the more reassuring it is. The less symmetric it is, the less reassuring it is. So that's one of the rules, symmetry, right? So it should, in general, one side should match the other side. And you can see in this melanoma here, in no way does any of this match. There's no way that you can fold this where it looks like it's the same on both sides, right? Not in shape, not in any way, right? And so this is definitely not good. It's fulfilling this rule. This concerning feature of asymmetry is this lesion's asymmetric. Next is border. So whether or not the shape is symmetric, the border should be nice and round, or nice and smooth. And so you can see here that this is an asymmetric thing, which is concerning, but at least the border is smooth, right? Same thing with this one, border is smooth. This one, when you have a jagged border or a very irregular border, that is a concerning sign. And in real life, it would look like this, right? You have a nice smooth border here, but then you've got this weird thing here. And then it's really feathery, and then it's really spiky. And this is bad, you know, this is not how normal, good, healthy moles look. So border is the next rule. And the next one's color. So in general, and there are some exceptions, but in general, moles should have one color or maybe two colors. And in general, the color of one mole should match the rest of the moles that you have. They should be a little family. They should all look kind of like each other. And this is not that, right? You've got black, jet black. You've got just porcelain white. You've got light brown dots. You've got medium brown dots. And you've got dark brown. And then you've got streaks and all these other things in here. So this is bad, right? This is definitely very, very irregular and has many different colors in it. So you sometimes can even see red or blue or other color. You can almost see blue in here a little, but you can sometimes see even other colors. And the more colors, the worse. The more colors, the worse. And so you can see here, like it's black here, light brown here. Sometimes we'll say pink and brown makes me frown. Sometimes people will say that kind of silly thing, but if it helps you remember, you know, that your moles should, in general, match each other in color and only have one color predominant, then that's helpful. D is diameter. So anything that's larger than a pencil eraser could be a concerning feature. So it's not to say that all big moles are bad. They're not, especially ones that we get in childhood. They're often larger, but particularly if a mole used to be small and now it's larger than this, that's concerning. It needs to be looked at. And then the last thing is evolution. This is something that's kind of a newer concept, but any other significant changes in your moles is worth listening to. It doesn't mean it has to be biopsied, but sometimes I'll look at a mole and I'll say, you know what, it really doesn't meet these other ABCDs. It doesn't really meet these criteria. And the patient will say, but you know what, it concerns me because it's really itchy now. That's a change. It didn't used to be. Or, you know what, it concerns me because, you know, it's really been kind of tender now, or it's been scabbing up and it never used to do that. And so it's not like any change for any mole means it has to come off, but these are the types of things that mean it needs a closer look. It needs to be looked at under a derm scope, or at least it needs a close inspection from someone with a lot of experience with this. And often, if there's multiple, you know, if a mole is, you know, if a spot is breaking more than one of these rules, usually it's peace of mind for everyone to get it off, you know, and make sure that there's not something going on there. So yeah, this is a very powerful tool for you guys to be advocates for yourselves and for your family. People come in, sometimes they say, hey, this mole's changing. And sometimes I say, guess what? That's not a mole at all. It's something else. And I don't want, I don't ever want anyone to feel like that's bad. You should be an advocate for yourself. And if you are concerned about something that's changing and growing, and it looks like anything that we've talked about today, it is always it's a very reasonable thing to be checked, and to have someone with more experience than you take a look at it and give an assessment and come up with a plan. And the plan could be biopsy today. The plan could be, we're going to take a look at it in 3 months, or we're going to measure it and we're going to look at it how it changes. Or there's a lot of things that we can do for you. It's not like it has to come off at it, for any reason. But what we'll do is based on the story that you give us and the way that the spot looks, we'll come up with a plan for you, and we'll come up with a right plan for your situation, and come to a good decision for you there.